I'm Jen. I'm the founder of Sober Livers, and we will get started in just a moment. We're going to start out with our agreements, and then we will go through a few things until we introduce our presenter for tonight, Kristin Smith. Again, my name is Jen Jones, and I'm the founder of Sober Livers and the HOPE program, which stands for Healing Ourselves with Peers in Education. And tonight is an education meeting that I'm very excited about. So I'm going to go ahead and first share our agreements so we can get started. Okay, so participation is encouraged, but please inform us in chat if you'd like to listen only. And feedback, please share your opinions with empathy and compassion using I statements. For example, I had an MRI instead of an ultrasound because I had iron overload. And so we do encourage feedback. And so please let us know how you're feeling. And if you have any suggestions for someone else, please let us know how you handled your situation. Medical advice, feedback is not medical advice though. Consult your health provider before trying anything discussed here. And please inform us if you're a medical provider. That way we can drown you with questions. Confidentiality, ensure you are in a private space. Please use headphones if needed, and please do not share anything with them about the members outside the meeting. Cameras are great. Please turn them on to foster connection. We are recording the first hour of this meeting. So if you have a question or a thought that you can either turn, okay, let me give you two different ways of doing it. You can turn your camera off if you want anonymity. But we do have this edited, and so if you've ever looked at one of our recordings, you will see that your face is not shown because Chris, our wonderful video editor and many other things to do with video, he goes through there and he does that for us. Anonymity, if you wish to remain anonymous, please use your first name as your screen name and keep your camera off. Inform the facilitator or Nancy really privately in chat. And please share your ALD stage or transplant status with us. We just want to make sure that you're supposed to be here. Abstinence. While abstinence is not required to attend, please join our meeting sober, hence Sober Livers. If under the influence, do not participate verbally or in chat except to contact a facilitator for support. Please give us your contact information and we can get you some resources. And politics, we are nonpartisan. Our focus is to share our experiences with AUD, liver diseases, transplant, and related issues. Secularity, we are primarily secular, but we welcome discussions on spirituality or religion as part of your recovery, following our feedback guidelines. So we're here to learn from each other, offering compassion, empathy, and kindness. So please take what resonates with you and leave the rest. So I'd like to start out tonight with some really great Sober Livers stars. And so I'd like to say happy 10-year soberversary to Nancy, who just came back. So I'm glad she came back for this. You were truly an inspiration to us. And then Jack just got a job at Stanford as a peer support specialist. She studied to be one. Now she is one. And we also have Chris as a peer support specialist too. So we've got some great people on board here, but congrats to both of you. And does anybody else have any type of anniversary or any exciting news that they would like to share? I can't see everybody's faces, so please raise your hand with your hand raising function. Yes.
I have 7 months post-surgery to the day.
Congratulations.
Nothing compared to 10 years, but
hey, you know what? It's step by step, right?
Yep.
Day by day, you'll get there.
Yes.
You'll get there.
Yes. Yes.
Hey, Kelly, what do you have to tell us?
Hey guys, I will be 3 years on February 1st.
Woo! That is awesome. Yay. Congratulations. Congratulations. Anyone else? Any exciting news that anyone would like to share? Okay, well, let's move on then. Do we have next? Okay, so I'm so excited to announce that we are going to have a vision board workshop with Nancy Jasso. Nancy is our chat facilitator. So any questions that you have, please put them in chat to Nancy and she will answer your question. If she can't, she will get an answer to you. And if you have any questions for our guest speaker and you don't want to say them out loud, please put those in chat and Nancy will let Kristen know. But this vision board workshop is going to be on January 30th from 8 to 9:30 p.m. It's Eastern. And so this is going to be virtual. So let's get together and have some fun. We want to start 2025 off with some creativity, aspirations, and joy. This will be both hands-on. So if you have any magazines or newspapers and you would like to cut things out to put on a board, then that would be great. We'll also offer virtual options, and I will send out how to, if you don't have Canva already, how to utilize Canva so that you can create a virtual vision board. Gosh, that's hard to say. And if you want to learn more, Nancy's going to be there for our reflections time today to answer any of your questions. She's also going to put her email in the chat. And then we will also be sending the information about this via email, and we'll post it on the Facebook group, and we'll explain to you all the materials and everything that you need to be able to create your own vision board. And let's build some community together. I want to share something, and I'm going to stop sharing this for a second because I want to see everybody's faces. So I have a story to share with you, and I'm going to be very brief so we can get our wonderful speaker started today. On Christmas Eve, the story starts. So I went to a liquor store, and although that doesn't sound good, we went there because we got invited, me and my partner Darwin, to go to a friend's house for Christmas, which was super exciting for me because I've been very isolated for a long time, and this is the first time I was invited to a friend's house for Christmas in a long time. So we were excited about this, and Darwin wanted to bring his favorite wine to give to her because she drinks alcohol as well as probably some of the other people that were going to be there. So he was going to get a Gewürztraminer, and where we are going has a big selection of non-alcohol beverages, and some of them are zero proof, meaning they're just made out of, actually I can show you. I found this really great bubbly concoction that's only fruit, and it's different things and really great. So I have a service dog. I'm not sure if y'all know that. His name is Artemis. He's a golden doodle. And I was sitting in the aisle or standing in the aisle paying attention to him when Darwin was looking at the wine. And I was feeling like I was in Walmart or something like that. I mean, I've been to a handful of liquor stores since my sobriety, which was 7 years ago. And I'll tell you, each time has gotten easier and easier. And this time it was like a breeze. And so I was feeling really good. And this woman walks up, and she had this white hair, and she had all these red accents for Christmas, I think. She had no wine bottles or anything in her hand. And she comes up, she starts petting Artemis. And she's like, "Oh, is he a service dog?" And then I thought, well, maybe she works here. And she said, and I'm like, "Yeah, but you can pet him. I have him for PTSD. I have it so I can talk to people." And she says, "Oh, you're so nice." And so she petted him for a while. And then she stands up and she says, "Give me your hand." And I was like, "What?" And she says, "Give me your hand." So she's holding her hand out like this. So I pull out my hand, and I thought she had dog treats or something. But then she gives me this rock here. And I was like, "Oh my gosh, this is crazy." And then on the back it says "Rock On." So I was reflecting on this rock going, I felt like this was like an angel had just touched me, because as I'm looking at this rock and looking at this rock, I'm thinking to myself, and I'm going to share my screen again, this rock looks a lot like a liver. And sure enough, when I got home, I printed out a liver and I put it on top of there. And oh my goodness gracious, it totally looked like the liver. So I put up here, well-being is realized in small steps, but it is truly no small thing. And that's how I felt when I was in that liquor store. Like I felt like, wow, I'm finally past these urges. I'm finally past all of these things. And I'm on the right track. So I just wanted to share that with all of you because it meant the world to me. I felt like I was touched by an angel. And I was so happy and so excited. So anyway, all I want to say is miracles can happen, and this was a miracle to me because I met this woman and I said to her, I said, Merry Christmas. She walks away and I didn't see her again. And neither did Darwin. And so take what you want from that, but it was really magical experience to me. So I'm excited. So please feel free to always share any experience to you that really touches your heart, because this one, I'll tell you, really, really touched mine. And with that said, I'd love to introduce our guest. And she is truly magical and a miracle to me. Um, because we've gotten to know each other very well. She's part of our whole health advisory council at Sober Livers. And I am going to ask Chris if he would please give her a wonderful introduction to her talk today. Chris?
I can't hear you, Chris.
You see him?
Chris,
Chris? Hold on.
are you muted? I think you're muted, but you're not. We can't hear you.
Oh. Okay. Huh. All right. Chris. Okay, give us 1 second. I will go ahead and make the introduction because we're not hearing from Chris here. So I will introduce her, which I would love to do. So Kristen, she's a somatic therapist and a Chief for Two embodiment coach with Harbor of Dreams Art in Stone Mountain, Georgia. And so her topic tonight is impact of trauma on brain and body. And she is passionate about educating and healing the many manifestations of trauma. She worked as the transplant mental health social worker for Emory Healthcare from 2020 to 2024. She learned how difficult it can be to maintain long-term sobriety for those experiencing alcohol-associated liver disease from her time at Emory. Kristen is a somatic therapist and a Chief for Two embodiment coach. Chief for Two is a polyvagal informed multi-generational trauma healing method. She works with clients in Roswell and Stone Mountain, Georgia, as well as online. She specializes in treating clients with complex trauma. She received her MSW from Florida State University and has been a clinical social worker since 2020. Personally and professionally, she promotes individual and collective healing so humans and communities can reconnect to themselves, each other, and the beautiful planet. And with that, I introduce to you Kristin Smith.
Off mute. Am I off mute?
You're off mute, yes.
Okay, thank you. Yes, so and it's interesting. I saw a lot of you typed your location in the chat, and there are a lot of folks in Georgia, so that's great. So yeah, just to say, yeah, I am a somatic therapist, which I'll explain what that is, and then Chief for Two embodiment coach. So basically, you did hear about my intro. I transitioned to private practice this past summer. So that's my relationship to transplant, just to clarify that. Yeah, so, okay, here is our outline for today. So I'm going to define trauma, then talk about different types of trauma, polyvagal theory, which is really essential to understanding what trauma is and how it manifests for us. And then talk about Chief for Two, which is the modality I'm trained in, as well as give an example of trauma so that hopefully it can feel more applicable to us instead of it just being, more of a medical type explanation. And then I just want to also add that please type as many questions in the chat as you would like as I go, but just for my own process, I won't answer anything till the end. So I just want to say that now. Okay. So what is trauma? This definition on the right is essentially a general definition of trauma. And I'm just going to give you a moment or so just to look over it, and then I'll get more into what is trauma. So I think a lot of us have heard that word a lot and maybe feel like it's thrown around a lot. I feel that way. I'm very appreciative that there is a lot more focus on trauma and trauma-informed care, but also there can be misconceptions around it, which, can not always be the most helpful. But here's in a very clear and definition of trauma that I hope will be explained by the end of this. So essentially, trauma is inhibited movement expression. And it's actually inhibited in the gut. The gut is our first brain if you look at it from an evolutionary standpoint. And I'm going to give an example of what an inhibited movement expression is later on in this presentation. So hopefully there you have some more context. Okay. So types of trauma. I know in the intro is mentioned that I work with complex trauma, but I mean, basically there's two types. So the first type is acute, which is oftentimes what people think of. So that's like maybe being involved in a serious car accident or robbed at gunpoint. Like it's a single, very stressful, threatening event. Oftentimes happens later in life, but not necessarily. However, complex trauma, or CPTSD, is repeated abuse and or neglect, usually from a family member, not necessarily, but someone who was around when we were younger. And it can also be pre-verbal. So, it's important if it is pre-verbal, which honestly it often is. It's important to know that because that makes a big difference in terms of having effective treatment. And it's honestly why a lot of mental health treatment is not always the most holistic or comprehensive in terms of its healing potential, because a lot of what's going on in the body when someone has early developmental trauma is missed. So I think it's an important distinction there. But another thing I want to highlight is, I know we're talking about like what is trauma, types of trauma, really trying to get like clarity around that before we move forward. But it seems to me for some time now, there's been a lot of focus on the event, like the traumatic event, and it's the event that makes it trauma. However, it's not necessarily the case. Really, it's what happens in our bodies as a reaction or response to the traumatic event. So you don't even have to worry too much about what the event is. It's more what's happening in the body. And knowledge of that really helps guide treatment and makes it more effective. Another thing I want to mention is, I looked this up, that if you look at the world population, approximately 1 to 8% of us have CPTSD, complex trauma. However, I really think that's grossly low. I think it's, a lot higher than that. And I have multiple reasons that's my perception, but for that perception. For one, it's a newer diagnosis. For two, I imagine a lot of us have seen mental health providers in the past. I've seen a ton myself, and misdiagnosis is it's rampant. And so that means because it's so common that, that's more likely to be missed. Also, there's still a lot of confusion about trauma and its relationship to mental health. There's just a lot of reasons why, unfortunately, mental health treatment, in my mind, has been subpar until we really had understanding of polyvagal theory and trauma, which is somewhat of a newer phenomenon. Okay, one second. Let me see if my mouse is gonna go. Okay. So polyvagal theory. That's a mouthful. Actually, I am curious. I know I said I wanted like questions at the end, but I'm curious if there could be like people could raise their hands if they've heard of this. I'm just gonna like, oh yeah, cool. Okay. Great, thank you. So just to say, it's a collection of neuroscientific, psychological, and evolutionary ideas about the vagus nerve's role in fear response, social connection, and emotional regulation. You see, it was introduced by Dr. Stephen Porges in 94, which if we do the math, I think 31 years. So that sounds like a long time to me. Let me tell you, mental health providers did not have very little knowledge about this till probably like the past 5-10 years, maybe. And even then, there's still a lot of therapists that don't know much about it. So just to say, even though it's been around, it's not necessarily become mainstream quite yet, although it's stuff I think it will be, pretty soon that it will be quite mainstream given the how much trauma is talked about. So the vagus nerve, I know I mentioned the definition here. And so what I want to say more about that because that's the reason that this called polyvagal theory is because of its connection to the vagus nerve. So vagus in Latin actually means wandering. And it has that name because it's such an extensive way in terms of its connection to so many areas and organs in our body compared to other cranial nerves. So it's just so crucial in our functioning and well-being. And then I know I mentioned earlier about developmental trauma. So no matter who you are, no matter what your birth was, you were born with a partially myelinated vagus nerve. So it was partial. So in order for it to become fully myelinated, there are certain things that had to have happened. So attunement with the mother through breastfeeding, especially, but also with skin-to-skin contact, which I think some of us know, like I've heard in the past however many years that now when women give birth, they're skin-to-skin right away because doctors realize how crucial that is for attunement and development. So those are some examples of things that when they happen earlier in life, improve the likelihood of myelination. You might be thinking, what the heck is myelination? So myelination greatly increases the speed of signals transmitted between neurons. All that's to say, it just helps. Basically, if you have a myelinated nerve, it's going to work a lot more optimally than if it's only partially myelinated. And another reason that proper myelination is so crucial for how our nervous system functions is no matter what you're doing, like right now, you might, you could be listening here and maybe you're by yourself in the house, or whether you're at the grocery store or you're at a concert, it doesn't matter like what's going on. No matter the situation, your nervous system is continually assessing and monitoring, is the situation safe or unsafe? And honestly, because our nervous systems are very nuanced in how they interact with our environment, a little shift in the environment can make us feel unsafe. And we aren't always aware of that, which I'll get into more what that can look like in terms of real world examples, which honestly is why a lot of us prefer not to be in big crowds unless maybe numbing agents are involved, because our nervous system is like overwhelmed by the changes in the environment and the changes in noise and the changes in movement. And it's just like constantly, okay, it was safe before, but then there was a change and it feels uncomfortable. So it's that it doesn't take a break, this system we have. Okay. I also want to mention a book. I read this book. It's called Nurturing Resilience, Helping Clients Move Forward from Developmental Trauma. I read it a few years ago and I I learned so much. I mean, it doesn't matter if you're not a therapist, it's still super informative. And I'm gonna also include resources and such at the end, but I just want to mention it in case anyone that wants to learn more about, especially the developmental trauma piece, because for me that was a game changer personally and professionally. Okay, okay, here we go. So polyvagal theory continued. So this is an infograph, and I got this from the Polyvagal Institute, which I definitely recommend as a resource if you have interest in learning more about polyvagal theory. They just have a lot of they have programs there, they have a lot of great information. That's definitely a place I recommend is Polyvagal Institute. So I'm going to go through these 3 states in our nervous system that polyvagal really explains. And yeah, because it's just really crucial in terms of understanding our experience. So you see the top one says relaxed. So the thing is, when we talk about trauma, and then especially when we use polyvagal theory to explain it, there's a lot of terms that are used interchangeably that honestly can make it confusing. Like I've been interested in polyvagal theory and studying it for many years now, and I still can get confused. So I think I just want to go ahead and like start with explaining that. So that relaxed state, it can also be called the ventral vagal or the social engagement system. And so in that state, it's when our bodies are functioning optimally. Our digestion, our immune response, our ability to connect is all like it's optimal as it can get. However, what can often happen because of traumatic experiences, because we live in a very chaotic world, I don't need to belabor all the crises all the time. It's not uncommon for us to perceive a threat and then shift into a more primitive state of being, basically. And so if we shift into that because there's a perceived threat, which can happen like very quickly, we're not always cognitively aware because our bodies, a lot of our sensing is through our bodies, and our brain interprets the shift in our physiological response in the body. But so if we shift down, then that would be to that mobilized state, which also can be called the sympathetic, or a lot of us have heard of fight flight, I'm sure. So when that happens, a lot of physiological responses actually increase. So heart rate, blood pressure, adrenaline. And while those are increasing, we also have a relational ability decreasing. So, that's something that's relatively common, like I said, just because of our daily stressful lives, is that shift there. Then the last one, which on the infograph is immobilized, is also called the dorsal vagal shutdown, or some of us may have heard it called freeze. So freeze is the most primitive one. And so with freeze, essentially almost all of our physiological responses, like our heart rate, our muscle tone, our blood pressure, are all dropping. One of the few things that increases is endorphins. And that is to block out pain because the threat is so big and so major, and we can't escape it. That's basically what our bodies decided, which I'll get into that with an example later on, that it's basically like our body's like, this is the last resort. And so the endorphins are there as a way to make it not as horrific. So another thing I want to say about the dorsal vagal shutdown or freeze is our awareness of the human voice, eye contact, and vocal intonations also decrease. So even communicating that someone's feeling incredibly overwhelmed and feeling they're a hard time, speaking and moving, and is very difficult. So it's definitely very difficult and awful to experience this. However, I think what's most important when speaking about this state is if you look at medical literature, like if you were looking at a journal article, they're going to talk about the shutdown state in its most extreme expression. So they're going to talk about it as like fainting or collapsing. Like, for example, an animal who's about to get attacked is going to do that because ideally the predator like loses interest and then doesn't end up attacking. But what's really more common for us is a more subtle shutdown response. And so, to give you a real world example of what that could actually look like for a lot of us, is you might have someone speaking to you, especially if it's someone there's power differential, like a supervisor, for example. They're speaking to you in a harsh tone, and you might feel like you have a hard time moving or even like speaking. Like you almost feel like flooded in terms of like not being, when I say flooded, it's like hard to think kind of thing. And so that I would say is a much more subtle but common shutdown response that most of us are experiencing, honestly, all the time. So I just wanted to make that distinction because I think otherwise it can get confusing when learning about polyvagal theory. Okay, so Chi for two. Hopefully this is a little more fun than what I've been saying. What you're like, what is this title? So so Chi comes from Tai Chi, and Chi is energy. And it's 4-2 because it's a relational practice. And then you can read here, which I know was stated in my intro, that it's polyvagal informed, which is why I was getting into some of the foundational knowledge about that. And then it's a multi-generational trauma healing method. And it's a distillation you see of several healing modalities. So it's very comprehensive. And yeah, it's been life-changing for me personally, which I can get into in a bit. But I also want to add, or I want to mention that this is the people on here are the people that created it. So Dee Wagner, she's a longtime body movement therapist. And then she co-developed it with her son, Stephen Wagner, who was a Tai Chi instructor. Mary Lou Davidson, who is a longtime body worker, and then Caroline Gebhardt, who is a registered yoga therapist as well as somatic therapist. And so I'm very fortunate because they are based in Stone Mountain. So that was, fortunate for me to have them based near where I live. So just a little bit more about my passion and my introduction to Chi for Two. So as part of being, those of you that are licensed professionals or no licensed professionals, part of it is you have to get continuing education. And so in the summer of 2022, I attended an event called Polyvagal Bites. And it was all about Chi for Two, and it was transformative for me personally. So when I found out that it was an intensive 2-year training, I was like, okay, even though I had never planned on getting an extra certification for therapy. That was never something that I had planned to do. But when I really got in touch with it and experienced it, I honestly couldn't not do it. And I say this, I really love when people give, personal touches to whatever it is that they do. Because I think, it humanizes us and we need that more than ever. And the way the society can be not authentic most of the time. But I really attribute Chi for Two for really helping me be able to work with those with complex trauma. And I say that because I have my own complex mental health and medical history. And I did a lot of therapy and I did a lot of different medical treatments, and it only helped somewhat until I found Chi for Two. So I'm very grateful for it. And then you see this quote at the bottom. I'm going to explain it because I just really love it, and I think it's like a really good way to have a sense about Chi for Two and how it can heal even intergenerationally. So you see it says when no is not an option, yes is not a choice. So many of us have experiences that have made it unsafe to express no, especially in situations where there's power differential. So when you're speaking with a parent or a supervisor, someone, not when I say power differential, it's not like a sibling or a friend. It's, it's a different dynamic. So what Chief for Two does is it helps people feel safe to move and speak in ways that maybe have been unsafe potentially for generations. And so finally, people have healthy boundaries that can be practiced, and intergenerational trauma can really start the healing process. So I'm going to get more into that because I know it can be confusing about when I say free to move and speak in safe ways. Okay. So this is an example I made up, but I'm going to read it to you. So when 5-year-old Tommy is attacked by a Rottweiler, his nervous system will bypass fight flight and go into shutdown when his body realizes he cannot realistically run away or fight back. Shutdown is a type of feigning death or simulating death that can cause the predator to lose interest. It's actually, believe it or not, 500 million year old system, if you look at it like from an evolutionary standpoint. But that fight flight activation gets inhibited in the gut. Because if you remember earlier, I talked about trauma is inhibited movement expression. And so as Tommy gets older, he will likely get triggered often because, well, basically when we have inhibited movement expression, it really still wants to come out. And so I can get into what that looks like. But in this situation, it's almost as if his body and his mind are questioning, is it safe for me to move in this way now? Because, right, it wasn't safe when he was 5. So the reason I picked 5, I think this is really crucial too when we talk about developmental trauma, is 90% of our brain development happens between the ages of 0 and 5. And that brain development is is impacted by our interactions with our primary caregivers, which, a lot of that's preverbal, which it makes it trickier, right? Because when it's preverbal and then we're dealing with language to heal, it's only usually partially healing, that's why I think like CBT for a lot of us, cognitive behavioral therapy, isn't always the most effective because it's really not getting at the crux of the issue. And I chose this photo because this movement, ideally, when you have access to movements and they're not shut down, you could do this if there is some kind of threat coming at you. It's a protective movement. So that's why I chose this photo when coming up with this. So Chief for Two in the real world. So I'm going to give a little bit more example, but then we're almost done. So I want to bring in some more examples of being triggered and shutting down that fight-flight activation. So we all know we live in a culture rife with ways to distract and dissociate. And when I say dissociate, I mean numbing part of our experience so that we're less present, because being present can be incredibly, incredibly overwhelming. It's just meditation teachers act like it's not that hard, but it's actually one of the hardest things that we can do. Because there's just so much going on all the time, and because so many of us have had many difficult experiences. So I don't want to minimize being present. It's really actually a huge deal to be able to do that even a little bit of the time. So here are some examples that may or may not resonate. But doom scrolling, I'm very guilty of that. Driving down the highway, seeing an accident, hearing an argument at a grocery store, or maybe a customer yelling at you, I would say are, more or less common triggering experiences. And what often happens if we experience situations that activate that once inhibited fight flight energy is it can be shamed when it's released. So I'll give an example. So what can happen is someone can be talking to us and we're feeling like this, like a lot of energy come up and we're feeling like a lot of aggression. And then we may or may not have an outburst, like a verbal outburst. And then the person or people on the receiving end don't validate it. And that's relatively common. And so there's this shame that then happens. So you can, I like to, if you know, it may or may not be helpful for you to picture this, but when I think about that fight or flight energy coming up the vagus nerve, because it goes like from the brain down to the gut, I think of it like that coming up. And if it's released and invalidated and shamed, it has nowhere else to go. So then it literally attacks the self. And when it attacks the self, it's almost always a self-shaming spiral, which I know all of us have gone down the rabbit hole because it is so common for us to do that. And I really believe that that's a lot of why we do it, is because of how often our fight flight energy being shamed again and again and has nowhere else to go but to attack the self. So it's very common when that happens, when we're going down the rabbit hole, to then reach for things to dissociate, to numb. So like, you know, the beer or the vape or the phone, so we can scroll away the overwhelm in our system. So as a Chief for 2 embodiment coach, basically I help people safely release the fight flight activation by catching and celebrating the movements and sounds that are laced with fight flight. And there's somatic ways that I do that, and it's a very relational experience. But once those movements and sound expressions are are relationally celebrated, then they can be integrated into that person's movement vocabulary. So this is a personal example, but I had a lot of difficulty like embodying no. Like if I would freeze quite easily if it was anything feeling like tense or like feeling like conflict. And so it was very hard for me to turn my head away and then and express no. And so since I've done this work, that's no longer something I struggle with. And so because of that, in interactions, it's much easier to maintain healthy boundaries because that no is now embodied. It's not even something I have to think about. So I said, I think that's an example that oftentimes is relatable, because I think so many of us do people please, or if we don't now, we maybe did in the past. But yeah, ultimately, the more movements we have access to, and when I say access to, I mean like when we're in relationship with someone, the easier it is to protect ourselves and practice those healthy boundaries in pretty much all our interactions. Kind of take a deep breath. Okay, so you made it. This is my reference is just to that infograph from the Polyvagal Institute, that Venn diagram. And then the book I mentioned is Nurturing Resilience by Kathy Kane and Stephen Terrell. It's just an amazing book. And then that's the website for Chi for Two for those of you that may or may not want to learn more about it. And then, thank you.
Thank you, Kristen.
Yeah, that's that. I feel like I'm complete. So thanks again for listening.
Will this slide be available?
Oh, the slides in general?
For that particular one, and probably the two last ones for sure.
Yeah,
I didn't get to see it, so I just want to write it down. Well, I guess I can. Let me take a picture real quick.
Sure. Yeah, no problem. Yeah, no worries.
And yeah, and then Kristen, if you want to share these with me too, these two, I can send them out.
Thank you.
Yeah.
On the website. So Kristen, thank you so much.
Yeah, you're
This was
welcome.
fabulous. I want to ask a question. I already put it in chat and because of my own personal experience
Yeah.
with some of these things. When you were saying that people are the power dynamic, I come from I'm a survivor of severe interpersonal violence. And my perception was my abuser was that person that had power over me. And so would that be someone that you would still have that with? And because my complex trauma, all this, the first start was in childhood, it led to me having the trauma that I had later on. Is that more of a perceived power? Because a lot of us with doctors and medical doctors, even though we're trying to level the playing field there, a lot of us feel like a doctor talking to us is talking down to us. And so what do you have to say about the perception of everything, even if somebody isn't really above you? You know what I mean?
Oh, totally. Yeah, that's why in Chiefre too, when movements are invited, there's certain movements that are invited when there's power differential, such as like I said, such as parent-child or coach-client, but then also ones when there is ideally power equality, like with friends or partners or colleagues or siblings. But it's ideal, right? Because so many of us know, like, because so many of us have really difficult and often traumatic experiences, choice can go out the window. I mean, when we feel intimidated and when our nervous system is no longer in that ventral vagal and it's shifted to the fight or flight, or more likely that subtle shutdown, we don't feel as though we have choice to maintain our healthy boundaries because of basically those experiences. So even if that person technically is not, like I said, someone where that's like a supervisor or parent, to us it feels like they have the control and it feels like we don't have choice. And one thing I want to mention actually, I listened to Dr. Huberman's podcast a while ago, and he had this really amazing Stanford psychiatrist, Dr. Paul Conti, and he said these two things, which I just really, really love sharing with people. He said that you can have all sorts of things happen in life. And for everyone here, I mean, my gosh, to have a transplant or go through this, like, right, I mean, it has to be one of the most difficult experiences that, I mean, anyone can go through. I know I don't know personally, but I've seen and heard. And so just knowing who I'm talking to, what the doctor said is whatever life throws at us, which I know those here it's thrown a whole lot. If we feel like we have a sense of agency, right? We can make choice in our interactions. And then we also feel like we have gratitude for whatever it is that we do have, right? It could be gratitude for being alive. It could be for anything. Those two things can really help us get through hell and high water. And so, like, when I heard that, I was like, wow. It's always so nice when someone simplifies it because I think otherwise it's so easy to get like, oh, it has to be this or it has to be that. And then there's like contradictions when you learn about, healing and you learn about well-being. But really, if you have a sense of agency and you feel like you have choice and you have gratitude, those can take you a very long way. So I don't know if I answered your question, but that was what came up for me.
Yeah, that's great. And there's a few more questions in chat. Nancy, you want to say those, or Chris, you can say your own if you want, if you can talk now. Okay, go ahead, Nancy.
Check.
Yeah,
Oh, Chris, curious. Okay.
now we can hear him.
That was really weird. I did open the document to read earlier, so maybe that's what did it. But so my question, I'll just read it. Do you work with and or treat people with substance use disorder using this methodology? And when somebody's on the transplant track, do you find this to be a successful form of therapy, both for the patient to, become sober and to continue in long-term sobriety? And also, is this recognized by transplant evaluation teams?
Oh,
Oh, yeah. Okay. Let me make sure. I'm gonna look at yours. I'm like, that's like 3 questions.
Sorry.
No,
mean,
I
yeah.
appreciate it. The first one though, I definitely do. I would say, yeah, anything. I mean, my preference is working with folks that have complex trauma or substance use disorders. Um, but in terms of like the success of this on the transplant track, I can't really speak to that because since I've transitioned from Emory, I haven't worked with someone who like, was pre or post transplant. So that's, that's one thing I don't want to like, say something that's not true. But so Chi for Two is pretty new. Like I think it's been around for maybe 4 years or approximately. And so even as like I know a lot of therapists locally and a lot of therapists have no idea about it. I would say it's like getting to be a little bit more well known now, especially since it got approved by ISMETA, which is that international group. But yeah, it's not, I wouldn't say it's a modality that like the majority of mental health or medical providers know of. However, I would say polyvagal theory is now getting a lot more traction, and so I've been very encouraged. Actually, I when I was at Emory, I did a talk on trauma informed care in the hospital because I'm just very passionate about trauma more than anything. And I found out that in Chicago, they actually have a consortium of like 16 hospitals that are trauma informed, which all of you who know the hospital, unfortunately, like better than most places, know like how many experiences in the hospital are incredibly difficult and oftentimes traumatic. And so to know that like there can maybe be hospitals that like are actually devoted to lessening the trauma and improving the support and healing is just, so good to hear. So I think it's just, it's just slow, but there's definitely, it's happening. Yeah.
And then there's another question. Dancy, you want to go ahead?
Yes, that was okay. I'm not muted. There was another one. Allison asked, can this therapy be done virtually?
Oh yeah, definitely be done virtually. The thing about it is, okay, so like as a somatic therapist, I can only do the therapy in Georgia, but the Chi for Two embodiment coaching can be done virtually anywhere because it's coaching and not therapy. So that is another distinction with it. I will say for those of us that have done therapy and done it virtually and then maybe done it in person as well, I think oftentimes it can be a bit more beneficial in person, but there's a lot of people that do it virtually and they do it virtually the whole time because they're not able to come in person and they still find it's very beneficial. So yeah.
Quickly, are there any more questions? Kristen is staying with us after for the reflections period. So if y'all want to stay with us for the reflections period, you can ask questions there. And so if anybody that has a pressing question that needs to leave, please raise your hand now. I have just a couple more announcements to give to you before we go into our reflections time. And Kristen, can you stop sharing your screen, please?
Sure thing.
Thank you. All right. And thank you, Kristen. That's so informative. And I love the Chi for Two. I think I think about the whole idea of movement and what that means. And I don't think we move enough. And I don't think we realize how important movement actually is for our bodies. So I definitely encourage anybody that wants to learn more about it to reach out to Kristen and share some more. So let me share my screen real quickly.
Can I add something to that?
Go ahead, please. Yes.
Anyone that, like you were talking about the movement and stuff, a lot of places I have done Tai Chi classes before.
Yeah.
A lot of community centers and stuff offer that, and it's very good therapy. It just reminded me of that.
Oh, thank you for sharing that. Yeah, no, movement can be
It's
medicine.
not
and
easy at first. There's a lot of steps to it,
Yeah.
and there also are videos on YouTube.
Yeah.
My mother
No,
loved
thank
it,
you.
and I was kind of lost when I went, but I watched some videos on YouTube so I could learn some of the movements.
Yeah, I've done it a couple times too. I really do enjoy it, and it's nice and slow and relaxing.
Yeah.
So if you don't do yoga because it's too complex, try try tea because it's a little bit easier. Okay, so if y'all haven't seen this on Facebook, if you're not part of Facebook, we have a clinical trial survey from the Wellness League, which is another program with the Fatty Liver Foundation. Sober Livers, the Fatty Liver Foundation is our parent company. The Wellness League currently shares information about clinical trials for people with metabolic dysfunction, which was the non-alcohol fatty liver disease. But they now are going to be sharing information for people with alcohol-associated liver disease. So please take this survey because it's really quick and it'll allow us to make sure that we get the clinical trials on there that y'all are interested in, and we're making sure that we're looking for the keywords that you are interested in. So we're really excited to get that started. And if you want more information about the Wellness League, if you go to the fattyliverfoundation.org or fattyliverfoundation.org, you can click on the Wellness League and get there. But we would really appreciate your voice. And then I talked to y'all about this last month, so I'll just briefly mention this. We're still looking for participants. For people with alcohol-associated liver disease, this is not for people who have had transplant, but this is a paid study. So I encourage you to, make some extra money. And also, this is really important because it's going to talk about the quality of life that people with ALD have. And this is going to help us with research and help us with treatment. So I encourage you to please contact this email with contact@cldq.org and or this phone number 202-530-6199. And if y'all want to take a picture of that real quick, I'll leave that up for just a moment. And if does anybody have any questions about either of those studies or survey and study? Okay. And so lastly, our next HOPE meeting is going to be on, not February 7th. I mean, February, I didn't finish it. I'm sorry. It's February 11th. February 11th at 7 p.m. Not all of February. February 11th at 7 p.m. And we hope you can make it. But again, Nancy is going to be doing this wonderful, exciting vision board workshop. And so if you want to find out more information about that, stick around and she'll be here to answer questions. And we will carry this on into our reflections period now, so we can go ahead and finish talking to Kristen. If anyone has any extra questions for her that they would like to ask her, she's going to make herself available to us. And we're just here to see how everybody's doing. So we have open discussion too. So if anybody wants to share how their holidays were or anything that happened over the holidays, the good, the bad, the ugly, go ahead. We're here for you to support you.
Has anyone made any New Year's resolutions, or is anyone?
I don't do
that.
How many people, a show of hands or virtual hands, how many people make New Year's resolutions? I don't think, I think we've learned not to do New Year's resolutions, especially people who have alcohol use disorder, because we understand that those are very, very difficult things to keep. I do a word for the year. Does anybody do a word for the year?
I do a word of the year, yes.
What's your word?
This year my word is focus. I have a lot to focus on and balance. Focus and balance. I have to balance what I'm focusing on.
No, only one.
It's focus, but I have to learn to balance things so that I can focus on what I need to be focusing on. Yes.
Anyone else or anyone want to share about any interesting things that happened to them over the holidays. I will tell you guys, I met an 82-year-old who had alcohol associated liver disease, only a 5% chance of living back in 1999. And she is still alive, has not had a transplant. So for any of you who are out there who haven't had transplants and have that question in your mind, she is the longest stretch that I've met of a person who has gotten alcohol associated liver disease without transplant. So it's possible, everybody.
Yeah. Jen, how did you meet her?
She was actually at my friend's house on Christmas. She was in town from Arkansas, visiting her son, it's a long story, but my friend was hosting the whole family because her ex-husband has ALS. And so she's still really close to her ex-husband, and so he can't fly anymore, so they all came to him. And so she was there. So it was pretty interesting.